Thanks for watching TMA's Legislative News Hotline for Friday, January 18th. I'm Brent Anir. Tuesday was Inauguration Day for Governor Greg Abbott and Lieutenant Governor Dan Patrick, so it was a shorter work week in the Senate and House chambers than normal, even at this point in the session. Still, we have much to report. Texas top health officers seek sufficient health funding, more on TMA's top legislative priorities, and first, the budget. We have our first look at lawmakers' budget proposals for the next 2 years. The House version, House Bill 1, was filed last week, and the Senate unveiled its bill this week. This session, the budget bill will originate in the House. That alternates every session. Both chambers propose a slight increase in state and federal dollars in health and human services spending compared to last session. Senate Bill 1 proposes just under $85 billion in spending for the next 2 years on health and human services related expenditures. Medicaid funding is set higher than the current 2-year budget, mostly because of increases in Medicaid caseload. Public health and prevention funding certainly will be part of the budget discussion. That was the topic on Monday when TMA hosted the 4 current and recent Texas health commissioners to discuss what the state needs to improve health outcomes. TMA's Marcus Cooper reports the Texas Public Health Coalition, of which TMA is a member, put forward their top priorities for lawmakers to consider. But first, TMA's Advocacy Vice President, Darren Whitehurst, summarizes TMA's public health priorities.
I think that on the mental health side, the legislature has invested several millions of dollars over the last several sessions. I think that interest will continue during this upcoming session. Things like tobacco cessation, we are seeing, particularly in the vaping realm, we're seeing a lot of underage use of vaping products, and they're selling these wonderful flavored, and it really is a pathway to ultimately getting into tobacco. And so want to try and force all those things from happening, and if possible, eliminate them from happening. And I think that one of the things that we're going to be focused on is trying to raise the age which they can purchase those tobacco products from 18 to 21. We worked on that last session. We'll continue to work on that this session. You also have on the public health side obesity, vaccines. Again, lots of efforts to undermine some of the existing programs that exist today, and want to make sure that we keep those in place.
Every single day from the moment you wake up, public health had something to do with your ability to go to the next step.
The Texas Public Health Coalition is calling on lawmakers to take the next step to protect Texans from the next big public health threat. Texas current and former health commissioners called for bipartisan action during the Texas Medical Association's Distinguished Speakers Series discussion.
Fighting against the germs, the viruses out there, and promoting the general welfare, that is core to government, the core to be able to have a healthy society.
The coalition supports funding for 4 priority areas of public health: tobacco prevention, childhood vaccination, chronic disease prevention, and investment in the infrastructure that delivers public health. The commissioners point to real-world consequences if the priorities are not met.
And what we often see as the problem, the obesity, the smoking, the drug use, is in fact to that person not the problem. It is their answer to the problem.
As legislators float their state budget funding proposals, the state's current health commissioner says the challenge will be to keep the focus on allocating sufficient resources to keep Texans safe.
If they saw how effective public health is at creating health security, at protecting people, at preventing disease, they would see that there's a great value there, and it's something that they would want to preserve.
In the coming weeks, the public health message will be delivered as testimony to the House and Senate committees that influence public health funding. Back to you.
So many decisions are made in legislative committees. Which lawmaker will serve on which committee? Soon we will know. Wednesday, Lieutenant Governor Patrick said senators will learn their committee assignments next week. Representatives gave their committee preferences to House Speaker Dennis Bonnen on Tuesday, and he will make assignments soon. When they're set, we will report on the committees important to medicine. Doctors hope several of those committees will support TMA's ideas to improve Texas's health this session. TMA's Healthy Vision 2025 details medicine's top priorities. To read it, visit texmed.org/healthyvision or tma.tips/HV2025 for the PDF version. We covered some of those top priority issues in last week's video. Darren Whitehurst returns to complete the list, beginning with maternal health.
Dr. Carden has set a very high goal for us, is that we would have zero maternal deaths that were unexpected. And again, I think that is a laudable goal, and that's what we'll continue to push with the legislature. Right now, Medicaid basically kicks off pregnant women that have delivered post-pregnancy 60 days after delivery. We need to change those types of things, and we need to be providing better continuity of care. We need to be providing better services to both women on Medicaid and in the Women's Health Program, and we will advocate in the legislature to do just that.
Some of those deaths occur beyond those 60 days and within that
That's
first
exactly
year.
right. Again, the vast majority do, and a lot of them are relating to substance abuse, and that's going to be a focal point of the legislature as well, is talking about substance abuse and trying to get better treatment programs and getting patients more involved on the front end, trying to get treatment for them and not letting them languish and basically letting them die.
Well, and opioids too.
Right.
Similarly, that's another huge issue.
Right. Had a lot of focus on that during the last legislative session, and that will continue this session as well. Had a lot of interim work that was done relating to opioids and the prescription drug monitoring program. We're going to be actively involved in those efforts to try and set up a system that makes sense. And for physicians, it doesn't make a whole lot of sense to have them having to take time away from their practice to check the prescription drug monitoring program. And so trying to get the legislature to see the benefit of automating that and having it tie into physicians' EMRs, trying to determine, don't want them checking every drug that they're prescribing. And so want to make sure that it is reasonable and appropriate for patient care. And again, that's what we're going to be advocating for this next session.
TMB sunset was up last session,
Right,
and essentially got punted to this session.
That's right. Ultimately, the bill was continued 2 years during the special session. I think that affords us the opportunity to really look again at the medical board to make sure that the processes that they have set up when physicians are accused of some sort of wrongdoing, set up a fair system for physicians that are accused, one that will, again, catches the bad doctors that are providing bad patient care, and the doctors that are providing good patient care and that are falsely accused, gives them a way of knowing what the process will be and of ultimately getting out of the process as quickly as possible.
And a lot of this ultimately happens because of the grassroots efforts.
Yeah.
I know you had some thoughts about that.
Yeah. Again, is that what makes TMA successful at the end of the day is our grassroots advocacy. It's a relationship that local physicians have with their elected officials. And so, again, going to push that model again this next legislative session. We have first Tuesdays at the Capitol, so the first Tuesdays of February, March, April, and May. The doctors will be en masse and go over there and talk to legislators about issues that are important to medicine. All those issues I just mentioned and a whole bunch more. So I would encourage the people watching to take time out of their schedule for one of the first Tuesdays that they can, all of the first Tuesdays if they can. But any way that they can be involved, would encourage them to do so. And again, we're successful because we have such strong grassroots advocacy efforts.
A tip. Make sure you continue to receive TMA's Legislative Hotline email report in your inbox via Texas Medicine Today. Here's how. Visit texmed.org/hotline. Click on subscribe in the first story. On the next screen, check healthcare issues in the Texas legislature like this one's checked. That's it. You'll receive Hotline daily electronic reports in Texas Medicine Today. Tell your TMA member friends. That's all for now. Please share this video with your TMA member colleagues. With TMA's Marcus Cooper, I'm Brent Anier. Thanks for watching. No video hotline next week, but please join us in 2 weeks for TMA's Legislative News Hotline.